Hello, we're here today to update you again on the coronavirus, the COVID-19 situation here in Nashua. First of all, I want to thank all our members, our citizens, our residents, our community members here in Nashua for coming together in order to help us fight this disease. We have done social distancing, people are wearing masks. These are very important things, and by so much participation, so many people getting involved, we have been able to contain the spread of the virus to a great degree, limit the number of cases, and save people, save our families, save our friends, our colleagues, really save people's lives. So I want to thank everyone for really pitching in and doing this. Right now, we have 761 cases that have been reported in Nashua. Again, certainly more than we ever wanted, but less than many of the other cities around us, Lowell, Lawrence, and other cities to the south, and Manchester to the north. Right now, since we've been able to really help contain the spread of the virus, again by working together, we have only 33 active cases. In other words, people who are still contagious, still have the disease, but have not recovered. Those people have been in contact with 127 others. So what happens is our public health department, led by Director Bobby Bagley, and our public health nurses, Kim Bernard and others, they work with all of the patients who have tested positive, and they determine who those positive patients, who they've been in contact with just before they contracted or shortly after they contracted the disease. They contact all of those people, and they work with them to persuade them, to tell them to quarantine, to tell them to isolate, to make sure they get tested, and determine whether they, in turn, have caught the coronavirus. So right now, public health and volunteers that are working with them every day are working with 127 of these contacts, in addition to the 33 active cases. Now, unfortunately, we've had 41 people die here in Nashua. And that is a tragedy that has just struck many families very, very deeply. Anytime that anyone gets coronavirus, COVID-19, and ends up in the hospital, it is a very difficult experience for the family. And the reason for that is, unlike if someone has even cancer or something serious like that, heart disease, the family can visit, can spend time with the stricken loved one. In this case, visits aren't really allowed and not really doable, because the person in the hospital could communicate this disease to family members. So family cannot really visit. People who have the disease are really isolated. These family visits occur only very infrequently, and then with all kinds of garb and all this kind of thing. So the so-called PPE, the personal protective equipment. So this is a really tough disease for anyone who ends up hospitalized, for the family of anyone who gets it. So we really have to sympathize and empathize with the family members. Now, of course, the measures that we need to take in order to contain the spread of the virus, wearing the masks, all the isolation, staying at home a lot, these are hard. These are hard things that we've undertaken. And it gets almost harder every day, all of the sacrifice that people, yourselves included, have made. It is very difficult. You know, do I really have to wear this? Or you go out of the house, this has happened to me numerous times, you go out of the house, you forget the mask, oh, I got to drive back home and get it. Being isolated from family, from friends, we really understand the importance of interactions, social interactions with everyone, our family members that might live in another state, with our work colleagues, with our friends, our coworkers. We're missing a lot of that, and a lot of things are being done remotely, and these are serious sacrifices that we've all made. But as I said at the beginning, by working together, by really pitching in, we have greatly limited the prevalence of the disease here in Nashua. But we really need to continue to exercise caution, because we see what happens in other states when they open too early and they drop the precautions. They drop the safety measures, people don't wear masks and the like. Take Florida, take Arizona. Right now, today, Florida had 9,000 plus new cases. And they've been at that level or above, 10,000, even up to 15,000 cases a day. Arizona, a smaller state, has been ranging between 2,000 and 5,000 cases a day over the last few weeks, to the point where the disease is more prevalent now in Arizona than it is in New York State. And we thought of New York State as being the epicenter of coronavirus, of COVID-19. And in terms of population, cases per population, it is far more prevalent in Florida and in Arizona and in Louisiana than it ever was in Massachusetts. And we thought of Boston as being a big hotspot. So these states, these states out of our region, who have not exercised the same kind of caution that we did here in New Hampshire and they did down in Massachusetts, these other states are suffering outbreaks that exceed what we thought of as very significant outbreaks, very huge hotspots right here in New England and the Northeast. So that shows you what the consequences are of not taking the right precautions. Now, certainly Washington is not helping. We are fortunate to be here in Nashua. Washington is not helping because there are certainly mixed messages coming out down there. But we here in New England, here in Nashua, understand the importance of working together to contain the virus and try to protect our family, our friends, and our coworkers. Now you're going to, I think, see some slides, but interspaced with my comments here. But I really wanted also to mention that if anybody who wants to be tested, if you want to be tested, certainly if you have symptoms, but even if you think that you'd like to be tested, people are being tested every Thursday here in Nashua at the Elm Street parking garage, which is right outside City Hall. These clinics are run from 3 p.m. to 5 p.m., and the tests are conducted by our public health nurses that work for the public health department and by often school nurses who volunteer for this duty. They're the ones who do the tests. Now it's by appointment only because they want to make sure that the people that come in are spaced out a little bit in terms of timing. But you can call 589-3456, 589-3456. That is our COVID-19 hotline, where you can call to make an appointment. You will receive a nasal swab test, which will take a short time, a few days, 2-3 days to get a result. Now, if you want to try to get antibody testing, there's information on www.nashuanh.gov/COVID-19. But antibody testing is not what public health is doing. They're testing for people who currently may have the disease. I'm going to turn this over in a moment to Sue Lovering, who's the city clerk, to talk about voter registration and the importance of the elections and how to register to vote and how to absentee vote in this coming election. So I'm going to turn you over to her in a moment. But I just want to remind you before we conclude, one more time, and most of you are well aware of these cautions. First of all, make sure you stay home if you're sick. Wear face masks whenever you're out, especially if you're indoors in a supermarket or somewhere else. You need to wash your hands frequently. Keep socially distant, at least 6 feet from other people when you interact, and that's especially important indoors. Avoid large gatherings and get tested. Get tested. Avoid large gatherings. That's where we see oftentimes the disease getting spread. There's an outbreak in a particular location, at a pool party, at a party that is being run on a private basis, a birthday party or something like that. Sometimes an outbreak occurs and there's a group of people who get the disease. So again, do everything you can to exercise these cautions, be careful, and please stay safe and healthy. Now I'm going to give you Sue Lovering, who's here somewhere. She's got a mask on and she's socially distanced. She's going to come up and tell you a little bit about the importance of the election and how to cast your ballot by absentee without having to go to the polls.
Thank you, Mayor Donches. My name is Sue Lovering, City Clerk, and with me today is Deputy City Clerk Nicole Reyes. And we would just like to briefly take a moment to update you on recent temporary changes to state law and encourage you, if you are unable to register to vote in person or to cast your vote due to concerns over the coronavirus, that you request an absentee voter registration packet and/or an absentee ballot by mail. Upon receipt, we will make sure that we get you these materials to your home.
Para pedir para solicitar una boleta de ausencia por la preocupación por COVID-19, puede pedir una boleta de ausencia por llamando al Departamento de City Clerk o por correo electrónico. El número de la oficina es 589-3010, opción número 5. Y esa forma es por las dos elecciones.
So August 27th is the last day to register to vote or make changes to your voter registration information prior to the September 8th state primary. Our office continues to accept appointments in person to register to vote or make changes to your informational card. You may also contact our office by mail, email, fax, or by telephone and request that these forms be mailed to your home. Once completed, we ask that you mail them to us or drop them off behind City Hall in the drop box at your earliest convenience. After August 27th, you may also register at the polls or in person, or you can simply check off a box on the absentee ballot request form and we'll mail you the registration packet form when we send you your absentee ballot.
Si te seguirá siendo aceptado por registrar en persona que eres una nueva registrar por elecciones. Los solicitudes de registrar de elecciones ausentes serán aceptadas por correo electrónico, fax, teléfono o buzón de entrega detrás de la City Hall. Recibo paquetes con instrucción enviadas por correo a su residencia. 27 de agosto es el último día para registrarse, para votar, para cambiar tu información o para registrar por primera vez.
So in addition to requesting to register to vote absentee, we're encouraging all our residents to vote absentee during the COVID-19 pandemic. You may download a request by visiting us on our website or by contacting our office. Please remember to sign your request, check off the reason for voting. There has now been added a basis for the concern over COVID-19, and return it to our office at your earliest convenience. Also, temporary changes to the state law now allows for residents to complete just one form to request a ballot for both the state primary and the general election. In closing, I would encourage all of you to vote by absentee ballot or to register to vote absentee during the coronavirus pandemic. And I welcome you to contact our office at any time with any questions. Our main number is 589-3010, option 5. Our fax number It's 589-3029. You may email us at the City Clerk Department at nashuanh.gov or by visiting our website. Thank you.
Las solicitudes de votar de ausencia para elecciones de otoño de 2020 está disponible en línea o puedes contactar la oficina de la City Clerk. Las formas se pueden utilizar para la primera estatal y para la elección de general. Correo electrónico, fax o entrega a mano a su solicitud a la oficina de la City Clerk, 229 Main Street, Nashua, New Hampshire. El número de teléfono de la oficina es 589-3010, opción 5. El número de fax es 589-3029 o correo electrónico cityclerkdepartment@nashuanh.gov.
Thank you again, and we hope that, and encourage you all to vote absentee and come out and we see you at the polls if you choose to do so in person. Thank you.
All right, well, we do have one question from a member of the press, and that's Kim Houghton, or she has a couple of questions. Has Nashua had any recent outbreaks? And what do those look like at various facilities? Now, we've not had any recent new outbreaks, but over the past few months, there was a significant outbreak at two of our congregate care facilities. First of all, at the Huntington down in the South End, there was a significant outbreak there, and they worked very hard to contain it. I believe everybody in the facility was tested. All of the employees were tested. A number of people who worked for the facility were quarantined, a number of the nurses and the like. And although a number of people ended up catching the disease there, they were able to contain it, to treat people who got the disease, contracted the disease, and then able that way to contain any further spread. But there were certainly fatalities there. Some of the people who died, and they were older, some of our older residents, some of the people who contracted the disease there died, some of our older residents. There was also an outbreak a little more recently at the Greenbrier Nursing Home. Again, a number of cases, a good percentage, I think over half of the people in the nursing home ended up with COVID-19. Some of those cases were serious, and some people passed away as a result. But the nursing home worked with public health, got people tested, got the staff tested, and there has not been a renewal of cases down there at Greenbrier in a little while. We work with those places where there are outbreaks, public health, to make sure that people get tested, to counsel them as to how to quarantine, to figure out who's been in contact with the positive patients. There have been a couple smaller outbreaks, very small compared to the nursing homes and the congregate care facilities, at a couple of restaurants, but again, those are a bit in the past now, and they've been worked through, and again, the cases were very limited in those restaurants. So as of now, there have not been any new outbreaks that we are aware of that have occurred in the last few weeks. We're still on the lookout for those. Public health is always trying to monitor all cases to make sure that any spread of the disease is limited as much as we possibly can. So that's our update. I thought I would give you one more bit of information. The 100th anniversary of women's suffrage back in August 1920, the passing of the 19th Amendment, which gave women the right to vote, occurred 100 years ago. So we're doing a celebration here in Nashua. It'll be virtual, but to celebrate the 100th anniversary. And we're going to be doing a book club on The Woman's Hour, The Great Fight to Win the Vote by Elaine Weiss. This will be sometime in late August. We'll be posting additional information about it soon. But what this book focuses on is the ratification fight in the last of the states that was needed to validate the new amendment. And that took place in Tennessee. Tennessee was the 36th state to ratify, and that was the number that was required, 36. So it's a very interesting book. I've already read it. I think you learn a lot about politics, about what happened, what Tennessee and the South were like at that time. You learn about, of course, about all of the people who worked so hard to extend the right to vote to our female citizens. In any event, I highly recommend the book, and if you have any interest in it, please join us for the book club. So that will conclude our update for today. We'll be back to you periodically to give you any further information, and if you have questions, please don't hesitate to call Public Health 589-3456. Thank you very much, and thank you for joining us.